I'm here with Rob Foster from NuSight Medical. Rob, I have in my practice, which is not exceptional in this regard, a lot of patients with ocular surface disease, a lot of whom have different levels of meibomian gland dysfunction, a lot of whom involve a great deal of chair time. It's worth it because they need it, and I understand that. But you're going to help me out because you have a product that addresses this. Is this something that I use in the lane? What is this? What's your product, Rob?
Actually, the NuLids device is not used in the lane. This is designed for home use by the patient. The idea being that you have treatments in your office that can only be performed by an eye care professional. This is designed to be safe and effective for home use, and it's used as an ancillary to those things that you perform in the office.
So what is it?
The NuLids device is a unique mechanical device for home use that a patient uses in between visits to the practice. Clinically, it's effective at opening up the meibomian glands, therefore increasing the volume of the lipid layer and keeping the patient truly comfortable between the treatments that you perform.
Rob, let's do a little show and tell.
Sure.
So show.
So this is the device itself, and if you wouldn't mind, hold on to the microphone.
I'm delighted to.
Thanks so much. The idea is the patient gets up first thing in the morning or the evening, whenever you are directing that treatment be performed. The tip, which is disposable, is sitting up on top of the sterile packaging. Patient pushes the button one time, activating a bright light so that they can see where the device goes, and the magnet pulls it into place, thereby maintaining sterility. Patient then places just one drop of a lubricant onto the tip of the device, and then depresses the button again. You teach the patient to do it over a closed eyelid. What's happening is the oscillating motion of the device is vibrating the meibomian glands and creating probably a greater capillary perfusion, which, and when it pauses, you move to the next eye, is opening up those meibomian glands and getting them to produce more lipid layer.
Here, you can take this back. So that's really, really neat, and certainly I'm all for things that are effective and don't slow down my workflow. How is the product vended, and what are the consumables for it, and how are they vended?
Great. The product is vended in a number of different models. Frankly speaking, some doctors just don't like to sell things out of their practice. Now, while the doctor can stock and sell these to the patient, and that is the most frequently used model right now, we also have a home delivery model and a prescription model. The home delivery model allows you to sign the patient up, get some financial benefit from the sale of the device, and of course the ongoing revenues associated with the use of the disposable tip. The RX model for institutions that simply cannot take any kind of reimbursement from their patients is designed so that you simply give the patient a prescription. They either call us or go online, order the device, and we will train them how to use the device and on an ongoing basis.
And this is something that's available now. This is not some future vaporware project.
We launched this product in September of 2018. We currently have about 4,000 of them out in the field. Patients are using them, probably 200,000 patient treatments right now. Safety profile is excellent, and the efficacy is also excellent.
Oh, really, really, really neat stuff. First of all, I want to thank you for sharing this with us. It's cool. No, it really is. And I especially want to thank you for being so very generous with your time with us today.
Absolutely. And if I might say one more thing, one of the uses that is coming online right now by ophthalmology is utilizing the device 1 month prior to cataract surgery. What we're finding is that the workup time for those patients is much faster because you've got a more healthy ocular surface and a tear film. The readings that one are taking, the axial length, the white-to-white readings, anterior segment depth, those readings are better. And of course, post-surgically, because the patient has a more optimal tear film, the patient's comfort and vision are also better.
Yeah, marvelous stuff. Congratulations.
Thank you so much. I appreciate you having me, Josh.